Okay, my name is Ainur, and I'm so glad to have an opportunity to start our today's session. Not only because I'm in love with dentistry, but also because we'll be able to take a look on one of the most incredible approaches in minimally invasive implant treatment. To make a long story short, we'll briefly observe background of IBS implant company establishment, compare all pros and cons of unique implant developed, check for education facilities, and last but not the least, we'll answer your questions on how and where to get it on the best deal. So, straight to the point. Implant surgery has shown marvelous advances with progress in medical technology. However, complicated technique and damage inflicted upon patient did not show much improvement. Among global companies, there's an implant company that expanded into global scale company, setting a new standard to the market. We are IBS Implant. In 2003, Dr. Wang, a dentist, had a doubt on conventional implant surgery and started an implant surgery research for minimally invasive surgery. After endless research, he developed Magic Surgical System, and in 2008 founded IBS Implant to produce, educate, and distribute the product that would satisfy new paradigm. IBS leading innovation and global standard R&D directly manage not only Korean subsidiary, but also US, China, Vietnam, and Europe, rising its position as an implant company that represents Korea. By holding annual symposiums, we have agreed upon MOU with dental colleges and in various nations, put our best effort to make IBS implant system as a world core technology. Unlike conventional implant system that makes incision on gum, IBS implant system allows flapless surgery and personalized surgery based on condition of patient, including bone density, bone mass, and anatomical structures. It has overcome the merit of conventional implant system, allow everyday life after surgery, and has faster recovery period. We have established state-of-art manufacturing system for collaborative research with clinical doctors and for safety of patients, realizing an efficient production and global level quality with precise quality inspection. IBS International Clinical Education Center provides theoretical education on flapper surgery and various practice optimized for minimally invasive surgery that can only be seen in the center. Even doctors unfamiliar to flapless surgery can easily perform the surgery after a session and are making a good outcome as of now. IBS owns multiple innovative patents for its implant design, thanks to the global level products and technological capacity, which at their excellence being appreciated with ICL, CE, and FDA approval. IBS has acquired intellectual rights with incessant research and technological innovations, and it continuously trying its best for its goal to become the world's first implant company in research, production, and education. IBS creates a new paradigm for implant. Every step from Korean number one towards the world best is made with effort to bring healthy and more beautiful tomorrow. IBS implant. And now let me introduce our speaker, Dr. Hanee B, the senior sorry, the senior researcher of IBS implant. She graduated from College of Dentistry, Lithuanian University of Health and Science. Uh, Dr. P, the floor is yours.
Thank you. So, hello, fellow doctors. My name is, as he introduced me, my name is Dr. Hanee, and now I am here to make a presentation about the minimally invasive implant treatment. I know that a lot of you doctors are already familiar with the concept of minimally invasive implant treatment. However, us AMI, which is short for the Academy of Minimally Invasive Implantology, we have a quite new concept of minimally invasive implantology. most of minimally invasive implant treatments, they only talk about the flapless surgery. But we don't stop there. We have mainly four goals of our concept of minimally invasive implantology, which is first, to minimize the damage on the soft tissue, and second, minimize the damage on the hard tissue as well. And for number three, we're going to minimize the number of surgery. This will be the similar concept of the flapless surgery. And four, we're also going to minimize the use of artificial materials, such as bone grafting materials or the membranes. So let me show you. This is a IBS implant, which is called the Magic Core. And this type of implant is optimized for the minimally invasive surgery. And as you can see, it has a quite new shape and it's like very new, right? So let me briefly talk about each part from the bottom. So from the bottom, the thread, it's called the magic fin thread. Uh, the G is okay. Anyway, it's called the magic fin threads. And as you can see, this is surface treated area. And what is unique about it is that it has a square rectangular shape of the thread, and it's very thin and long. By making it in this shape, what we are trying to do is that we're going to take the initial stability by the morphologic contact rather than the crushing and fixation method. And second, because the thread is very long and thin, we have the optimized ratio between the implant titanium and the peripheral bone. So the ratio is roughly 1 to 9. And that way, we're going to preserve a lot of inter-thread bones between the threads. And on top of that, we have the magic cuff. This is machined surface, smooth surface. This is the part where the soft tissue will be adhered. And it's like the color of the tissue level implant of like Straumann and stuff. Here, because it has very small diameter, we're going to have great gingival seal, which is going to be great help for the bone to be healed underneath. And on the very top, this is called the magic post. This is where we're going to connect the abutments or connect the crown itself there. And this is not on the soft tissue level. This is actually above the tissue level. Let me go deeper into it. So yes, what I'm going to do from now on is I'm going to talk about each parts of Magic Core. And like the slide before, I'm going to start from the bottom. So I'm going to talk about the threads. So when we talk about threads, we want to compare this type of magic fin thread to the conventional triangular threads. So as you can see, and I said before, you see that this type of thread, the magic fin thread, has long, thin, square shape of thread. And the conventional thread is very short, has a smaller, short thread depth, and it's also mostly triangular shape. And these are the quotes are they are saying the advantages of having a lot of inter thread bone preserved. One of that says like when the thread pitch exceeds 0.8 millimeters, the minimum stress was obtained, meaning that when you have bigger pitch of implant threads, the stress will be lower, meaning that because we have a longer space between each threads, we're going to have larger pitch, which will exert less damage on the bone. And this is another advantage of having that type of magic fin thread. On the left, okay, this is the picture of the No. Finite element analysis. I'm sorry, I had to translate that in my head. Finite element analysis. And on the left, you see the conventional bone level triangular threads. And on the right, this is a magic fin thread. And the red surface represents the functional area. So for the bone level triangular threads, the functional surface is always almost 5 millimeters from the top. And on the red area, there is the area where the stress is exerted the most. On the other hand, this is the magic fin thread, and as you can see, all the red area continues to the bottom. This happens because it has very long depth and thin thread. What it means is that the longer the what do you call it? The length, the longer length of the implant you have, the longer stress distribution you're going to have, which is going to be better. So clinically, it is possible to apply narrow and long implants with this type of magic fin thread. And this one is about the peripheral bone. As you can see on the left side, this is a conventional triangular thread.
আপনাকে
And
আগে
it,
আমি দেখছিলাম।
আমাকে দেখেননি, আমি প্রথম আসছি, আমি আগের কাছে থাকি ভাইয়ের বাসার।
is everything okay? Can I continue?
Yes,
Yeah, okay.
everything is all right. One of our honorable teacher is with us, AKM Sarwar Alam
I
sir.
see, I see. Okay.
Welcome, sir. Okay, please continue.
Okay.
Your active thread.
Okay. So on the left side is where when you are placing this triangular thread. As you can see, the thread itself is thicker and shorter, right? And you are going to make the osteotomy according to the core body size of the implant, right? And then you're going to crush the bone while you're placing the implant, right? On the other hand, for the magic fin thread, it's very long and thin. So instead of crushing the bone around the osteotomy, it's going to slice through the bone. So it's going to give a lot less damage on the peripheral bone. It means that you can even have the faster loading time because this is it gave less damage than the conventional triangular threads. And this is a clinical example. As you can see, can I write? Okay. As you can see here, this was the pre-operative picture, and along this yellow line, this is where we presumed that the bone will be healed to that level. So according to that, we placed the implant like this. I know that it looks like the thread is exposing, but we are going to have secure soft tissue seal there, and we're going to expect this much of the bone to be filled in there. And as you can see, voila, it the bone has healed to that level, right? So that was another advantage. And now I'm going to move above is the cuff part. Before I talk about the cuff part, I want to talk about how the soft tissue will become after the placing the bone level implant. And from this picture, as you can see, after you place the bone level implant, you're going to connect the healing cap, right? And after the bone has healed, because you need to take the impression, you're going to disconnect this healing cap and you're going to connect the impression coping in there. And after taking the impression, you're going to disconnect the coping and reconnect the healing cap, right? while you are performing this type of things, you are detaching the soft tissue seal. You are continuously interfering with the soft tissue sealing. And by the time you put the final prosthesis, and after a few years of the final prosthesis delivery, you're going to everything okay? Okay. You're going to observe a deeper circus here, and once the circus has formed, it's going to become deeper and deeper, and it's going to reserve the marginal bone. So that's the peri-implantitis, right? But let's compare that to the magic core. Magic core, because this is how you place it, you want to have the marginal gingiva here, and this magic post will be exposed above the gingiva. Then you see that after you place the magic core like this, the soft tissue will be adhered to the cuff. And even after you're taking the impression, healing the, connecting the healing cap, connecting the closing screw, whatever you do, everything will happen above the tissue level. So nothing will interfere with the soft tissue adhesion. So even after the final prosthesis delivery, the soft tissue adhesion will be protected. And because it is protected, now it's going to even grow further to the top, which is we call own growth effect. So if we have that own growth, because we have secure soft tissue sealing, we're not going to observe any peri-implantitis, and it's also aesthetically satisfying. Let me show you an example. So this is when we first started.
Pardon, please.
Yeah.
The sound is not clear. If you please say it loudly, it will be audible.
Okay.
Thank you.
Is it good
A
now?
bit, yeah, a bit loudly.
Okay.
Now it is okay.
Oh, great. This is an example. So we placed an implant in a healed ridge. This is something called the guide pin, but I will talk about that later. So we placed the implant, and 2 months after the placement, we started the loading, right? We put the prosthesis, and 6 months after the placement, as you can see here, what we call the own growth happened. The soft tissue not only has healed, but it has extended above the original level, right? Which means that it's going to have great gingival soft tissue seal, and you will not observe any peri-implantitis after this. Okay. This is another advantage of the cuff. As you can see, if you have such bone like this, if you have a narrow ridge of the bone, if you wanted to place the conventional bone level implant in this type of situation, you have no choice but to perform bone grafting here to avoid thread exposure, right? However, for the magic core, because we have this cup part where the soft tissue adhesion will happen, we don't have to perform the bone grafting. Rather, we're just going to use this long cuff implant. And without any thread exposure, we can successfully place the implant without bone grafting, without thread exposure. And this cuff comes in various sizes. The magic cuff comes in 2, 3, 4, 5 millimeters. So you can choose in the various situations. And this is an example. So as you can see, the ridge is very, what do you call it? Narrow. Sorry. The ridge is very narrow. And you can see there's not enough attached gingiva, right? In this case, we're only going to have a minimal incision like this. This is what we call the semi-lunar incision. It looks like the half moon. And then just push that much of gingiva to the buccal side, and we're just going to place the implant like that, without bone grafting, without suture, nothing. So this is a picture of the guide pin. This is what we use before placing the implant. We just wanna check the placing path with the guide pin before placing it. I'm gonna talk about that later. And along this path, we use the implant, replace the implant without bone grafting. Rather, we only use the long cuff, and here on this side will be, this is the buckle. Oops, it's not working. Okay, buckle. And this is lingual, right? So as you can see, this part, the bone is adhered to the smooth surface, and here the soft tissue will be adhered. So this is how we do it for the magic cuff. And lastly, we're going to talk about the magic post. Magic post, obviously, because it is on the top, we're going to connect the prosthesis there. So before that, let's look at how we're going to place the bone level implant. If you want to place a bone level implant in such situation, you're going to have to perform bone grafting here, because you want to place your implant in the red axis here. This is the direction of the occlusive force, and this is the path you want to place your implant, right? But in order to do that, you have to perform bone grafting here, because to avoid the thread exposure here. And okay, let me tell you this first. So if you perform bone grafting here, this is not one of our concept of minimally invasive treatment, because it uses artificial material. And to avoid using the artificial material, you're going to have to place your implant along the blue axis. This is something we call the bone-driven implant, right? But if you place the bone-driven concept with the bone level implant, then that's how you're going to place your implant, right? If you place your bone level implant along this blue axis, then now you have problem with making the prosthesis. You're going to connect your abutment like this, and because now the direction of occlusive force and the direction of prosthetic connection is very different, we're going to observe the fixture fracture like this picture on the right. That's why we think that the two-piece bone level implant is not optimal for the minimally invasive treatment. However, this is what we do. We want to place our implant in the bone-driven concept because we want to perform minimally invasive treatment. And even if we place an implant along the blue axis in the bone direction, because it has a strong connection on the outside and inside, we have very strong prosthetic connection, and it is okay to fabricate prostheses in such direction, and it's going to survive. Let me show you an example. So as you can see, this is a premolar, and you see that implant was placed in this axis, bone-driven concept, right? Like this. However, you can see that you have to make the crown in this direction, like here. And even if we place the implant like this, it is perfectly fine to fabricate a magic crown in such direction, and it's okay to just connect it like that, and it has survived until now. So that was another clinical examination. And after that, I want to show you a video about like a brief summary of what I just said. And after the video, I want to talk about some surgical techniques that we have for the minimally invasive implantology. Okay, let me. Oops, how do I start this? It doesn't work because I used the pen.
Oh.
Oops. I'm sorry.
Yeah, play it.
Right now. Okay.
Technological advancements in the medical
Okay.
field and devices have enabled us to change the direction of surgery from invasive procedures, which leave large scars, to minimally invasive concepts, thereby reducing damage and pain to the patient, as well as increasing healing speed and recuperation. However, in the dental implant treatment field, procedures are still being done with the flap being opened with a large incision, giving immense damage to the patient. Since the year 2003, Ibs Implant has researched and developed an implant system with the concept of minimal invasiveness as the focus. Currently, the Ibs Implant system is being widely used and is showing successful results both clinically and scientifically. While conventional implants secure stability by fixation, the stability by morphologic contact of the Magicor implant preserves live bone, which makes early loading possible. While conventional implants require a minimum surrounding bone width of 2 millimeters, the Magicor of Ibs Implant only requires 0.5 millimeters of surrounding bone to be successfully implanted, even without grafting. The thread design of the Magicor allows a 9:1 bone to titanium ratio, which minimizes the differences in rigidity and flexibility between bone and titanium, giving the Magicor implant an advantage in stress distribution and minimizes chances for microfractures. With conventional implant systems, bone grafting is needed in many cases, but with the Magicor's various selection of cuff lengths and a shape that enables placement depth adjustments, successful implantation is possible by selecting from a variety of implant sizes, which fit the varying shapes and sizes of each case's bone shape. Upon removal of the healing
Sorry. I'm sorry.
abutment, soft tissue becomes damaged, and both the wound and implant are infiltrated by bacteria. If the soft tissue is repeatedly disturbed, the junctional epithelium migrates downward, resulting in loss of connective tissue mix. Because the gingiva is damaged, undergrowth occurs, the reaction of the body of marginal bone resorption in order to regain the lost connective tissue. On-growth occurs, a reaction resulting from healthy periodontal conditions. The bacteria between the fixture and the abutment multiplies, resulting in peri-implantitis. The inner attachment surface of the crown and the innovative outer structure of the core crown is simultaneously attached to the implant, enabling fabrication of a widened occlusal surface with anti-rotation and seamlessly prevents prosthetic detachment that may occur from vertical and horizontal forces.
Why is it continuously stopping?
It's the end.
Oh, is it?
Technological
I'm
advancement.
sorry. That was the end. I thought it was not the end because the speaker didn't stop. Okay, so that was a brief summary of what I just talked about, the characteristics of the Magicor, the implant which is optimized for the minimally invasive implantology. And now I want to talk about some surgical techniques that we have. Okay, so first off, when we are placing the implant in the like basic cases, what we do is something called a magic fit drilling and magic implantation. For short, we call it MFD and MFI. Basically, what it is that we are forming the osteotomy in the exact shape of our implant in the first place, so that we're going to minimize the damage on the bone, and we're just simply going to place the implant with hand in the already formed osteotomy. So this is to show you how to actually perform that MFD and MFI. Let me see.
Bone quality is diagnosed using the magic split.
Okay. Oh, okay. I'm sorry. I wanted to like stop in the middle. I did, but it didn't. Sorry.
Bone quality is diagnosed
With
using
the
the
magic
magic
split. Okay, what we do here is that we want to diagnose the bone quality. We just want to make sure that it is not a D4 bone quality, because if it is D4, we are not going to use the drill to form the osteotomy. So after that, can I continue?
Pardon, louder, please. Louder, please.
So if the bone quality is not D4, if it is denser than D4, then we are going to use the magic drill. So this is how to check the bone quality here. And then
drilling is performed using the pin drill. Guide pin is inserted.
and
CT is taken to confirm the path and implantation location.
so here we're going to place this magic guide pin. So after placing this guide pin, we are going to take the Cbct so to make sure that this path is correct. And
Engage the magic drill onto the guide pin and drill up to 5 millimeters and remove the guide pin.
And then we're going, as you just saw, we're just going to engage the magic drill. Magic drill is a hollow drill, so that it is possible to engage the drill itself onto the magic guide pin, right? And
Drill using the magic drill to find desired depth. Remove the bone core using the spoon excavator.
because the magic drill is a hollow drill, after drilling it to the full depth, it's going to form this bone core in the inside. So we're going to remove that bone core with the spoon excavator. Let me show you.
Remove any leftover bone from the floor using the depth drill. Insert the magic pin into the prepared implant bed. Remove the magic pin body.
This magic pin is for the tap drill. What does the tap drill does is doing the thread preparation, but we want to prepare that thread in the same direction as well. So we're going to use this. Let me show you.
Engage the magic tap drill onto the magic pin guide and drill slowly, less than 20 rotations per minute. Reverse drill to remove the magic tap drill, then remove the magic pin guide. Place the implant by hand, noticing that the magic core spin thread matches and follows through the created tap within the wall of the hole.
As you can see here, because we already prepared the thread pads, it is very important to place the implant with hand, not to damage any more bone around it.
Place implant to desired depth using the torque ratchet. Which implant and surgical method would you prefer?
Yeah, that was the MFD and MFI, and that's the very, very basic protocol that we have. Next, I'm going to talk about something called CMC technique. This is a short for crestal approach with membrane control. And as you can see, this is our very unique technique for sinus elevation. We use the CMC technique when even the residual bone is less than 4 millimeters. I know that in a lot of other cases, when the residual bone is too thin, then still a lot of doctors choose to open the lateral window and take the lateral approach. But in the AMI, in the Academy of Minimally Invasive Implantology, we think that this lateral approach is too invasive. So what we want to do for the sinus elevation is that we want to take the crestal approach no matter the situation. So let me show you. This is the tool that we use for the CMC technique, and it's very unique. And because of its unique shape, it is possible to perform CMC technique in the very difficult situations. Let me show you how it is done. I think it is easier to see that. So when you have this sinus elevation case, what you want to do first is that you want to remove all the residual bone until there is only 2 millimeters of residual bone left on the sinus floor. Of course, if you have a thinner bone there, then you don't want to drill anymore. You just want to start right away. And if you have 2 millimeters or less of the residual bone on the sinus floor, what you want to do is you want to apply the magic sinus lifter. And as you can see from, I want to use the pen. Okay, got it. As you can see here, as you are applying the magic sinus lifter, it's going to form that much of a bone fragment, and the instrument and the bone fragment are in the direct contact, which means that the instrument will not be in the direct contact with the membrane, so that there is no possibility of the instrument making the perforation on the membrane. And we are going to use the mallet, and we're going to perform gentle tapping. And you can elevate the sinus floor as much as you want to do. And after elevating it, you want to place the bone grafting material inside. And after that, just place the implant. Very simple. So let me show you a clinical case. This is a patient, and as you can see, that day we plan to place on the right side molar area. So we wanted to place number 15 and 16. On the 15, we used a different method. So I'm just going to talk about number 16 in this case. That's like here. So this was the Cbct, and as you can see, the residual bone was very, very thin. And because it was very thin, we used the endophile to locate where we want to place the implant and to check the path. And with the endophile, we took the Cbct, and you can see it here. Okay, so the direction, the path, and the location is okay. So we used the drill. We made a little bit of indentation. As you can see, it's a very, very small hole there, very minimally invasive, right? So to that hole, we apply the magic sinus lifter, and we perform gentle tapping, and we lift the sinus floor, the membrane, and perform bone grafting here. And then just place the implant like that. So simple, but let me show you the result. Here you see it from the Panorax, and let me show you the Cbct too. There you go. So as you can see, we performed the bone grafting even minimally too. So the shape of grafted bone has a dome shape, and we took the crestal approach. So it's very, very minimally invasive. So this is the pre-op and post-op CBCT view. And I think that's it for my presentation. Yeah.
Dr. Pe,
Thank
you
you.
very much. Thank you very much. It was really very interesting topics. The minimally invasive implant treatment was always something that discussed in the world, and it's not just like flapless surgery. It's really minimal invasive. I think it's time to get some questions asked.